To your health this morning. Listen, you may know the count and amount of your blood pressure. You may even know your cholesterol level. But do you know that you have sticky blood? Lionel Randall didn't know, but Dr. Paul Grubel, who is the director of the Sinai Center for Thrombosis Research at Sinai Hospital, knows all about it. First of all, let me start with Lionel. You're 36 years old. You go to the doctor because you had a couple symptoms here, like allergies, I thought, maybe. All of a sudden, a week later, your heart's being opened up. You're going through bypass.
Yes.
How'd that come?
I just was having just some shortness of breath and some burning sensation in my lungs. Went to my primary care physician. She went through some tests, did an EKG, which didn't look too right to her. Got me to the cardiologist, had some other tests done, stress test, phone just started ringing, people trying to find me. Went back to his office.
Lionel, you had no history in your family about heart disease or whatever, and it was because of sticky blood.
Right.
The platelets. Explain, what is sticky blood, doctor?
Well, what we're learning is that one of the most important risk factors for patients with vascular disease, heart disease, that's associated with heart attack is really the propensity of the blood to clot, the risk of the blood to clot. And one of the key components of that is actually composed of the platelets. And it's when these platelets stick to one another, that's when the arteries tend to close, and that's what causes heart attacks. And we can actually measure that at our center. And we've particularly studied it in patients who've had stents implanted in their heart, and we can identify the patients who are at greatest risk for an event, an adverse event, after they've had the stent put in.
Lionel, you don't go to the doctor, what happens?
Die. Heart attack. I just was very aware of my body, and I decided that something wasn't right. Went into the doctor, and a few days later I was on the table getting a bypass, and I know many guys my age feel that they're invincible, thinking that could have been just an allergy problem of some sort or just some type of bronchitis, and just ignored, and they end up having a heart attack. I mean, it happens all the time.
Doctor, yeah, let me ask you this. When we see in the news 36, 37, 42-year-old men who run every day, all of a sudden they drop over because of a heart attack, am I taking a leap that it could be because of sticky blood?
Yeah, the underlying cause of the artery to close is really the platelets sticking together, and we can actually measure that now. This is, up to this point, it's been sort of an unrecognized risk factor, and this risk factor has been particularly studied in patients who've had stents put in their heart.
Is there any medication?
There are medications. We use aspirin to block the platelets from sticking, and we use another agent called clopidogrel, also known as Plavix, to block the platelets from sticking. But very importantly, these drugs don't work in everyone. So what we're trying to do with our research at Sinai is identify the patients who respond to these drugs adequately, and also to identify those who don't respond. In our research, the patients who don't respond to these drugs are the ones who've had the adverse outcomes.
So what would your advice be for people who don't know? We don't have a family history, we're feeling okay. What would your advice be to those people?
Up to this point in time, Jamie, this is still a research tool.
Yeah.
It's not ready yet for prime time. But as the field evolves, I would predict that this will be a standard test that will measure in everyone who has heart disease. It will be an established risk factor.
Lionel, what do you say to that? What do you say to those people?
I say that get checked.
Yeah.
I mean, definitely get checked, and hopefully when this test comes out, more and more people will not have to suffer the fate, and the pain that I had to go through to get my artery cleaned out. And again, just don't ignore what's happening. Just go to the doctor again, and I just try to tell as many people as I can about going to the doctor. Don't just be the Superman and thinking that you are invincible.
Well, you look great today.
Thank you.
That. Doctor, keep it up.
Thank
keep
you.
the research. Let us know when it's all ready and going. Lionel, great job, man.
Pleasure.
All right. Megan.